I request the Collector of Madurai District, Mr. Veeraraghav, to ascend the dais and take the seat. Honorable Governor of Tamil Nadu, Thiru Banwarilal Purohit, Dr. Subramanian Swamy, Additional Chief Secretary to the Honorable Governor, Mr. Rajagopal, IAS, Collector of Madurai District, Mr. Veeraraghav, IAS, the Chancellor of the Vellore Institute of Technology, Dr. G. Vishwanathan, the Vice Chancellor of the Tamil Nadu Dr. MGR Medical University, Dr. Geeta Lakshmi, Dr. Satish Devadas, parents, students, friends, ladies and gentlemen. We have just got onto the dais after inaugurating the Ida Scudder Academic Block. It was nearly 100 years ago, an American woman called Ida Scudder. She came to India with a missionary father. She saw the plight and suffering of people in India's villages. She saw how India's villages lack qualified and trained doctors. So she decided to start a medical college. She went to the then governor of Madras Presidency, the first Baron Wellington, to seek permission to start a medical college. And Governor Wellington asked Dr. Scudder, "How many buildings do you have?" And Dr. Scudder said, "I'm yet to start construct one." The governor asked Dr. Scudder, "How many staff do you have?" And Dr. Scudder said, "I'm yet to recruit the staff, but I'm looking for the brightest and the best." And then Dr. Scudder was asked, "How much funds you have?" And she said, "I'm on a fundraising mission. I will raise money for my friends and family." Governor Wellington had a hearty laugh. So you have no funds, you have no buildings, you have no staff, and yet you want to start a medical college. But the great governor that he was, he quickly recouped and said, "But you have a strong will, determination, and the grit. I will grant you permission to start a medical college." And the story goes that Ida Scudder went on to build one of the greatest medical institutions in the world, Christian Medical College, Vellore. Nearly 100 years have passed since that meeting that Ida Scudder had with Governor Wellington. I also returned from America, and I also went to meet the governor, the Honorable Governor of Tamil Nadu. And I told him, "Sir, I come from a small institution. The name is Glanis. We have a small building in a small piece of land in a rural village near Madurai. But I want you to come and inaugurate our campus." I handed him a letter of invitation. The Honorable Governor read every word of that letter. And then he looked up at me and said, "You come from a small institution. You have a small building located in a small piece of land. But I will come and inaugurate your campus." It's been 100 years, but they say history repeats itself. Once again, Tamil Nadu has got a great visionary governor. Our Honorable Governor is a unique combination. He's a seasoned politician, he's an astute administrator, he's a journalist, he's a social activist, he's an entrepreneur, he's an educationalist, all combined into one, all packaged into one. States usually ask the central government, "Please give us this package or that package." But Tamil Nadu has got the best ever package. An erudite, scholarly, and visionary governor. History is replete with examples of what visionary leaders can do to the mass psyche of a country. It was in the 1960s President John F. Kennedy announced that America would put man on the moon. And when President Kennedy made that announcement, no one in America knew how to put man on the moon. There was no technology, no computers, no sophisticated navigation systems. But yet when President Kennedy made that announcement, the whole country marshaled its resources. The scientists and technologists got together. And in 1967, America did put man on the moon. An example of what the vision of a leader can do to transform a nation. And when Neil Armstrong set foot on the moon, he said, "This is one small step for man, but a giant leap for mankind." Sir, when you set foot on our campus today, it was a small step you took, but it was a giant leap for our hopes, dreams, and aspirations. In our midst today, we have another tall, visionary leader, Dr. Subramanian Swamy. When I was growing up as a child, he was my hero. It was the dark days of emergency. All the political leaders were put behind bars. But one man was elusive, and that was Dr. Subramanian Swamy. There was an arrest warrant out for Dr. Swamy. Back then, Dr. Swamy was a member of the Rajya Sabha. But if you don't sign the attendance register in Parliament, every 6 months, your membership will lapse. So just before the 6-month deadline, Dr. Swamy coolly walks into Parliament. The House was in session. An obituary of the deceased members of Parliament was being read out. Dr. Swamy strides into the central hall and raises a point of order. Mr. Speaker, in your obituary list, there is a notable omission. Democracy has been left out from the list of the deceased. Having said this, Dr. Swamy coolly walks out. And Mrs. Indira Gandhi puts the entire might of the Indian intelligence and police to hunt for Dr. Swamy, but he's nowhere to be found. I grew up hearing the legends of Dr. Swamy. And then in the late 90s, when I went to Harvard University, there I met Dr. Swamy. I was a fellow at Harvard Medical School, and Dr. Swamy was a professor at the Harvard Summer School. And since then, Dr. Swamy has become my friend, my mentor, my guide, my philosopher. In the United States, we organize these public meetings for Indian politicians. And when Indian politicians came to speak, it was hard to mobilize a crowd. It was hard to fill up the seats. But when Dr. Swamy was a speaker, it was not hard to fill up the seats. It was hard to find a seat. The auditoriums were jam-packed. That is the popularity of Dr. Swamy in the United States. And that is why I think Dr. Swamy is not a regional leader. He's not a national leader. He's a global Indian leader. Dr. G. Vishwanathan, Chancellor of VIT, nearly 25 years ago, he was the Honorable Food Minister in the Jayalalitha cabinet, and I was a student secretary at Madras Medical College. And as a student secretary, I invited Dr. G. Vishwanathan to come as a chief guest for our college program. He graciously accepted and came. Nearly 25 years later now, I invited Dr. Vishwanathan to come to the inaugural program of a college that I started. And again, he is graciously accepted and come. Thank you so much, sir. They say that the Vellore Institute of Technology is a world-renowned institute. And they say that if you want to know how to run an institution, go see VIT. And I've seen that, and I've learned so much. The Vice Chancellor, Dr. Geeta Lakshmi, when I was a student at Madras Medical College, she was an assistant professor. She rose up to become the vice principal, the dean, the director of medical education, and now she's ascended to become the vice chancellor of one of the most prestigious universities in the country today, the Tamil Nadu Dr. MGR Medical University, which is the second largest medical university in the country, running around 690 courses affiliated in medicine, dentistry, and allied fields. Thank you so much, madam, for coming today. A collector, Mr. Veera Raghava Rao, has been a great source of support for us for this project. Thank you again, sir, for coming here today. We also have another collector in our midst, former collector of Madurai. She was the first woman collector of Tamil Nadu, Mrs. Chandralekha, specially handpicked by the late Chief Minister MGR. A bold, enigmatic, daring, and dynamic officer, a crusader, relentless crusader against corruption. She's a source of inspiration for many young civil servants. For me, she's always been a great source of strength and encouragement. Thank you, madam, for coming here today. In the last 200 years, we have seen tremendous breakthroughs in medical science. In 1797, Edward Jenner discovered the world's first vaccine. In 1928, Alexander Fleming discovered the world's first antibiotic. And these through breakthrough inventions and discovery, they dramatically transformed the fame of medicine, the face of medicine. Back in the 1800s, if you were born as a human being, the most you could expect to live was up to 35 years of age, because that was the average life expectancy back then. But today, in the developed world, the average life expectancy is in the 80s, and in the developing world, it's nearing the 70s. Thanks to improvements in human health, human life expectancy has increased, and along with increase in the human life expectancy, what is improved is human productivity and human ingenuity. If you think about it, all of the inventions that have changed the way that we live our lives today, radio, television, electricity, satellite, automobile, aeroplane travel, All of these things have happened only in the last 200 years. The human species itself is around 200,000 years old. And what did not happen in the last 200,000 years has happened just in the last 200 years, thanks to improved human health, increase in life expectancy, and human productivity. Countries that have invested in human health have reaped rich dividends, and countries that have not have fallen by the wayside. Investing in health is investing in human capital. Investments in human capital directly translates to economic progress. A country in which its people are diseased and dying can never achieve economic progress. Today, India's healthcare problems are complex. India has the largest number of tuberculosis patients in the world. India is the diabetes capital of the world. India is the hypertension capital of the world. Every minute, we are losing a life to cancer. Every fifth minute, we are losing a child to diarrheal illness. It's a time bomb that's ticking. It's a catastrophe that's waiting to happen. It's a calamity that we can't afford. And yet, India has one of the lowest per capita healthcare expenditures in the world. India spends only 1.4% of its GDP on healthcare. Compare this with America's 18% and China's 7%. We have to get our priorities right. We have to invest our money right. If we don't do that, it'll be a historical blunder. It'll be a monumental mistake, too late to correct, too grave to rectify. India today has 0.9 beds for every 1,000 population. This is against the world average for 3 beds for every 1,000. India today has 1 doctor for every 1,500 population. This is against the world average of 1 doctor for every 700. To plug the gaps in India's healthcare infrastructure, India needs to add another 2 million hospital beds. To plug the gaps in India's healthcare workforce, India needs to add another 1 million doctors. To be precise, India needs to double its number of doctors, triple its number of nurses, and quadruple the number of healthcare technicians. And again, it's just not a matter of numbers. It's not about how many doctors we produce, but what kind of doctors we produce. It's not about building more medical institutions. It's about building better medical institutions. Arthur Shapiro wrote in his book, From the Ancient Priest to the Modern Physician. Back in the ancient times, when people felt sick, they did not go to the doctors. They went to these priests. And these priests did not have stethoscopes, equipment, antibiotics, but yet they laid their hands on these sick people and cured their diseases. With love and compassion and care. And that's what Shapiro calls the placebo effect. And that is why in medicine, what is important is not just equipment, technology, and expertise. What is important is love and compassion and care. And that is why medicine is not just a science, it is an art. I must tell you that it was Sir William Osler who said that studying medicine without books is like going to an uncharted sea. And studying medicine without seeing patients is like not going to see at all. Good clinical training is a cornerstone of a good medical education. And our students receive the best of the clinical training at the Devadas Multi-Specialty Hospital. Dr. Satish Devadas is a wonderful teacher. My father was his professor and today is a professor for our students. I envisage that in the future when the Glanis hospital comes up here, our students will receive their rural health training at the Glanis hospital and the urban health training at the Devadas hospital. I foresee a future in which the collaboration between Glanis Institute of Medical Sciences and Devadas hospital flourishes and grows in the years to come for the benefit of students and for the benefit of patients. Ours is a land of Sushruta and Charaka. It's a land of Dhanvantari and Aryabhata. There was a time in history when we exported knowledge to the rest of the world. We are the nation which taught the world the meaning of the Gita, the essence of yoga, the value of zero. But today we are importing all our medical equipment. We're importing the technical know-how for our vaccines and antibiotics. That's because in our country today there is no invention and discovery. In our educational campuses there is no innovation and research. Our students are smart and knowledgeable. They can memorize, they can learn, but they cannot innovate and create. Our educational campuses must inculcate a culture of research, must foster a scientific spirit, must foster a spirit of inquiry, that inquisitive mind, that curiosity, that sense of wonder. After all, the world's greatest inventions and discoveries have come from that sense of wonder and that curiosity and the questioning mind. When Isaac Newton wondered about the falling apple, the laws of gravity were born. When Gregor Mendel wondered why the peas in his garden were so similar and yet so different, the principles of genetics were born. When Edward Jenner questioned why the milkmaids in England did not catch smallpox, the world's first vaccine was discovered. When Alexander Fleming questioned why bacteria died when molds were added, the world's first antibiotics was discovered. And that is why today we inaugurated the Gregor Mendel Learning Center, the Alexander Fleming Laboratory, and the Edward Jenner Library, so that our students get the inspiration to dream and imagine, to innovate and create. A lot of people have asked me why I left the riches of America and came to a small rural hamlet in Madurai to start a hospital and start a medical institute. I've always had this idea that I must return to my motherland and establish a world-class medical institution. It was Victor Hugo who said, "You cannot stop an idea whose time has come." The time has come. So I have come, the Honorable Governor has come, Dr. Subramanian Swamy has come. Now you cannot stop an idea whose time has come. Sir, you've come all the way to inaugurate and lay the foundation stone for the Glanis Hospital. The foundation will be built very strong, and the edifice on the foundation will be tall. The impact will be deep and wide and far. I can assure you that we will build a world-class medical institution here, an institution that you will be proud of, Dr. Swamy will be proud of, the Vice Chancellor, the Chancellor, the Collector, each and every one of you in this crowd will be proud of and cherish. Thank you so much.